Hello and welcome to episode 5 of the On Air Advocate, where we look to provide education, support, and empowerment for all of those with different abilities, mental and medical illnesses, and their caregivers. My name is Tammy Flynn, and I am your host as well as a producer of the On Air Advocate, and I'm absolutely so excited that you have joined us here, whether it be during the day or evening, whenever you're viewing this, to hear episode 5. This week, our theme over at the On Air Advocate is Hydrocephalus Awareness Week. And so I am joined with Hydro-Warrior Mom, Laurie who is not only a special needs mom, she is a single mom, she is a caregiver, she is an advocate, she is a working mom. So without any further ado, bring it on in, Laurie. Tell us a little bit about yourself, Laurie.
Okay, well, thank you so much for having me, Tammy.
I'm so excited that you said yes to this because you are like just a fountain of knowledge and you have gone through many trials and tribulations, and I can't wait for you to share.
Well, our journey with my son actually began before he was born. And for a lot of families that I meet, their journey begins at birth. So ours is a little bit different because at 20 weeks gestation, I went in for a routine ultrasound and was told that my son was not going to have a brain. That was pretty big news. And they said it exactly like that. So there was no making that a nice, slow understanding of that.
Right. Now, before we dive completely into that, just so that all of our listeners or viewers of this kind of get a full picture of you, you have a son and you have a daughter, correct? Okay. And what are their ages?
Sure. Matthew is 8 and Annika is 6.
Okay. So Matthew was your firstborn.
Correct.
Okay, so you did not know, I'm saying this was your first pregnancy, correct?
Right. First pregnancy, everything seemed to be normal.
Okay, everything seemed to be going the way it was supposed to be. So you're working, celebrating life, pregnant, you're at 20 weeks?
20 weeks.
20 weeks, you go in, they do the ultrasound, and they say that he has no brain.
Correct. And that at that point, they sat us down with the geneticist, they sat us down with the neonatologist, and they started to discuss with us what that meant. Our son was born with a condition called hydrocephalus, and hydrocephalus is common actually. Generally tends to happen after birth, but it's considered water on the brain. Okay. And what that water is cerebral spinal fluid, which is a whole bunch of different nutrients that are made inside the brain cavity and then filtered down through the spinal column.
Okay.
And in our son's case, he has a condition called aqueductal stenosis. So there's a little tiny channel at the back of the brain, and that was actually shut off. It never formed and it was closed, so the cerebral spinal fluid or water inside his brain cavity couldn't pass down.
Okay.
So it just kept expanding and expanding and expanding.
Okay.
Because of that pressure of the fluid, the brain was not able to develop as typically developing. And there were a number of structures.
This is what they were seeing with the ultrasound. Were they seeing this in the ultrasound?
They could see it all in the ultrasound.
Okay.
Yeah.
Okay.
And so that's where, right at that point, they were like, well, you need to terminate the pregnancy. That was their advice. Obviously, I was not comfortable with that decision at that moment.
Right.
And I asked to run tests. Or what could we do? Like, how could I become a more informed person to make a more informed decision?
Right.
And they, at that exact moment, were able to then schedule me for an amniocentesis, which is a test where they are able to actually withdraw fluid from around the baby.
Right.
And then run tests on that. So the first thing that they wanted to do was run that amniocentesis and see how viable the baby actually was.
Okay.
because with a condition as severe as ours was, they were, the doctors really thought there would be what they called catastrophic organ failure. So even though the organs are developing, they should be actually shutting down. And we couldn't see that with an ultrasound.
Okay.
So that test was run that same afternoon while I was at the doctor's office. We had to obviously wait for results, but I was then in a waiting period and starting to figure out who do I consult with when a geneticist, a neonatologist, and other doctors that were starting to be brought into my case over the next few weeks all said that this pregnancy needed to be ended.
Okay. Okay.
So long story short, I went through 6 hospitals, 17 doctors to put a team together that could guide us to the end of the pregnancy. And there was no guarantee there was going to be a live birth at the end of the pregnancy. It was truly
Now, was
believed
that
that
all, was that here in the state of Wisconsin?
that was here in the state of
Was that
Wisconsin.
doctors that were outside of the state? So when you found out all of this information and you were seeking, some answers or information from other doctors, other suggestions, other parents that maybe have had the same experience, was it hard to find the content of information you were looking for? Because it is what your son has, the type that he has, a rarity for you to be able to find other parents that you could bounce things off of?
Right. So I found other people who had hydrocephalus who were living normal lives, but they had had it develop in adulthood. It was very hard for me to find a family. In fact, I didn't until much later.
Okay.
Where children had a hydrocephalus in utero, and even harder to find the specific kind that my son had.
Okay. So that formulation of those 16 different doctors, or just like kind of 16 different people on his team?
I went through 16 different doctors, and many of them fell off because they didn't believe in what I was doing.
Okay.
But I was able to find, luckily my OBGYN was just phenomenal and decided to stick with me on the entire path all the way through. And then we eventually added other doctors and specialists, neurosurgeons, craniofacial surgeons, because we knew that if we would get to life, there were going to be multiple surgeries that would need to happen to hopefully sustain life.
Okay. And so now you find your doctors, they're seeing you through, your OBGYN is going to see you through during the pregnancy, and now it comes to delivery day. On the date of delivery, was it a planned delivery?
Yeah, it was a planned C-section.
Okay.
In fact, when the day we found out 20 or 19 weeks earlier, at that ultrasound, his head was already so large, I needed to have a C-section even if he would have died in utero. Okay. So the C-section was planned.
The fluid was just building on the brain.
Yep.
Okay.
The C-section was planned, however, he decided to come early because babies have their own way of doing things. So 2 days before he was actually planned to come, he decided he'd break my water, and in the middle of the night, of course, we had to go to the emergency room and then to the delivery room. And my poor parents who live 3 hours away, I don't know how they made it here. I swear they made it here in like 20 minutes, but it really wasn't. But we did alert the cavalry, and everybody came running pretty much to the hospital because they didn't know if he would live at birth, and everybody wanted to at least acknowledge the birth and be there for that.
Okay. So now he's born.
I know, it was amazing.
So now he's born. And then what was next?
Well, that first day that he was born was actually pretty incredible. We were told he would be blind and deaf and probably die within moments of birth. So when I gave birth, and they wrapped him up and brought him to me and gave me, told me I needed to kiss him, told my husband to get out the camera and take a few pictures because we weren't going to see him for a while. I knew that he must have been a pretty big fighter because they weren't going to give him to me. So they actually took him, and he got admitted right into Children's Hospital of Wisconsin, into the NICU, and they started running tests immediately and developing a plan in order to help save his life. And my husband came running back to my recovery room to say that they found the optic nerve and his eyes were working. We didn't know if he could see at that point. I know. We didn't know if he could see at that point, but his eyes were working, and they had said there was no way they would ever function.
You know, isn't it such a crazy thing how, you know what I'm saying, all the things that are said that they won't do, you know, as I think that I've told you about before, you know, with my son Marcus, you know, they didn't think that he would ever walk, you know, never eat on his own. Clearly he walks, he runs, he jumps. It's that whole thing of belief, you know? Is that you have to believe because miracles happen every day. And so, and your son right now, I know he sees.
Oh, he sees, he hears, he walks, he talks, he's in third grade.
Right, exactly. Okay, so he's running back. You find out that the eyes are working. He's at Children's now, engulfed in that. How many weeks stretch of that is he staying at the hospital?
Well, that's the amazing thing. 11 days later, we walked out with him. 11 days.
Okay, so at 11 days, what were you going home with? Because, you know, aside from being new parents,
right?
I mean, that in itself is something. But now I'm certain you had a plethora of things that needed to be done. Because did he have a shunt place?
That needed to be done. By the 11th day that we left, he had already had 2 surgeries. So he had had 1 brain surgery, and he had a revisional surgery that we won't go into, but almost bled out during that surgery. And never thought in a million years we'd be walking out with him. But we were walking out with him in a specially crafted, and this I thought was really cool, a specially crafted car seat. So we had bought a car seat that met a whole bunch of specifications for his needs.
Okay.
And then the team developed what they needed to stabilize him in the car seat. So it actually took us about an hour and a half to get him in a car seat initially, because he had to wear a crown on his head and a collar around his neck and stabilizing equipment underneath his body, because his neck was so small compared to the size of his head that his neck could break easily with the weight of his head.
Right. So now when you were going home, I'm assuming he had a shunt. Did he have a shunt placed at that time?
Yep. He already had a shunt placed at 4 days old.
Okay. Can you explain to the listeners, because not everyone who's going to be listening to this knows what a shunt is or any of those things. I know that in our world, sometimes we just get so used to talking about different things that we don't always explain it further, but just so everyone else knows. So what do they do when they're placing the shunt, and where does that go?
Sure. So my son has what they call a VP shunt, and I can't tell you the medical terminology. I'd slaughter that. But it is a shunt that is placed inside the brain that drains the fluid off the brain, and then the tubing runs down over his lungs and then into his stomach, and it dumps the excess fluid into the stomach, and then it just leaves the body as waste material.
Okay. And that keeps the pressure off of the brain.
Correct.
Okay. So he left with a shunt to go home. Was he eating on his own, or was he on was he being G-tube fed? Or
no, he started off with an NG tube for the first few days, and then they were able to transition him over to a bottle.
Okay, so he was going home. He had a normal suck and everything else that way? Yes. Okay, so he goes home. And what's next now? I mean, he's home, and what did they kind of line up for you as looking at that that plan of what was going to be next for him?
There was so much within those first 2 weeks that we were home. So we had a in-home visiting nurse who had to check him out almost daily.
Okay.
He had to go to the pediatrician 3 times a week.
Okay.
He had occupational therapy that came in and worked with him. He had physical therapy that came in and worked with him. And we had social workers and case managers. I mean, in the first 14 days we were home, we had 21 appointments.
Oh my gosh.
So whether that was inside the home or outside the home, it was a lot. And my surgery for his C-section did not go well, so I could barely walk, much less drive. So the logistics were very difficult for those first few weeks.
And did you feel within all this, I mean, granted, you did have a little bit of a heads up because you knew at 12 weeks that there was going to be something going on, but you know, as I always talk about, learning how to advocate for your child and making sure you have the best doctors and making sure that you have the best of, you know, that they're on task of what they need to do. I mean, with this being so many different things and then you also being compromised from having the C-section, did you find that overwhelming to make sure that all the things on the checklist were getting checked off at the level of care that you would have wanted them to be?
It was very overwhelming those first 2 weeks, especially because Matthew, my son, was not able to be held like a normal baby.
Okay.
So he was, anytime we carried him or picked him up, he had to be held a special way with a special pillow, and everything had to be very balanced. We were lucky that they actually modified our bassinet, so materials that went into the bassinet to hold him. So we could push him around the house a lot easier than we could carry him.
Okay.
Which that was one logistical thing that made our lives a little bit easier. But one thing that made it more difficult, even though he could take a bottle, he could not breastfeed. So I had to pump and then feed. And that was very trying.
Very trying during that time, especially while you were recovering.
Right.
Okay. So now let's kind of speed a little bit forward. So he's home, he's had surgery. So if you brought us up to speed or within, if you were to say from that birth to, because right now he's 8 years old, you know, to even 4 years old, 5 years old.
Well, most of his extensive stuff happened in the first 2 years.
In the first.
So at 6 months, he had 2 more surgeries, and in 8 months, he had another surgery, which was what they call a craniofacial vault remodel, where they actually had to take out the skull and rebuild it and put it back in.
Okay. And was there a long hospital stay for that?
That was a very long hospital stay, and there were multiple complications. And because of those complications, he required an additional surgery because he had a hematoma, so a blood clot, that then formed from the surgery and it sat on his nervous system and paralyzed him on the left side. And therein began a very different journey and a diagnosis eventually of cerebral palsy.
Okay, so now he has hydrocephalus, he has cerebral palsy, and so now working with that, what did that require after that happened, after you found out that next diagnosis? Was it therapy for that side?
Lots of therapy.
Like lots of therapy for the side that was compromised?
Right. There was a lot of therapy. During the paralysis, he also lost the ability to suck a bottle and then was on an NG tube, which is a nasogastric tube that runs behind the ear and then down from the nose and then down into the stomach. And he was fed that way for about 6 months. They kept thinking his appetite would come back and the muscle movement would come back, but it didn't. And we then had to go and have a G tube placed in him, which is like a balloon that goes into his stomach, and he's fed through a port in his stomach, and he still has that today.
Okay, so does he just have it in, or is he still fed that way as well?
No, he's still fed that way.
Okay, so does he table food, eat some, and some G tube?
He eats some pureed foods, so he's still on baby food.
Okay. Okay.
But about 80% is G-tube fed.
Okay. So that was at around that, you said around that 2-year mark that you found out about the cerebral palsy. Is that around 2 years or 4 years?
It occurred at 8 months, but he wasn't classically diagnosed until about 3 years old.
Okay. So now, though it's a big speeding forward, and you've now had another daughter.
Right.
Now that you've had another child. Bring us up to speed within this journey. Well, one, along this way, what did you find the most difficult when it came to resources, whether that be community resources, support groups, other parents? What was a challenge? Not like what you've in the end learned how to do, but like in that interim, what was really hard? Friendships, people around you. I mean, did you feel, as so many different caregivers do, parents that have children that have different needs, so that alienation, that so many do? Or where were you at with all of this as this is all transitioning?
As that was all transitioning, our friends became fewer and fewer and fewer. Mm-hmm. Less people were visiting at the hospital when we'd have longer hospital stays. Matthew also has epilepsy, so we would have stays for long-term monitoring, which is where you're running tests for 24 to 48 hours at a time.
Okay.
So during that journey, the friends became less, family visited less, family invited us to fewer places, fewer family gatherings. Mm-hmm. And eventually you just kind of find that it's your spouse and yourself. And I think due to a lot of stress and a lot of changes, I mean, I lost my job because of my son, and eventually my husband lost his job as well. That really takes its toll on a marriage.
Mm-hmm. It definitely does. I mean, they say that the rate is, the rate of divorce is already high, but the rate of divorce is even much higher when you do have children, with significant special needs as well. But right. Along that time, with kind of having everybody become more scarce, and because we could do a whole podcast just on that section we just said, a whole one. But did you find that there were any resources or key people that really kind of helped you through that time? Like, I always, as you know, now we haven't even talked about the fact I'm wearing this in support tonight because I used to work for Children's, and Laurie works for Children's Hospital Wisconsin, an amazing, amazing facility that we treat our kids at here in Wisconsin and around the United States, a leading hospital. But my kind of mentor, the person that I looked up to, is actually someone that you work with now, that was, 20 some years ago. So right. Who did you have anybody that you kind of looked up to, had other, children like this, or maybe it was a therapist, a PT, an OT, a worker? Did you find that there was anyone at that, in that interim of that storm of less friends coming over, it being just you and your husband, more confrontation and friction that way, that really kind of said to you, Laurie, you got this, you're gonna do this, you're gonna do it?
We had the first 3 years my son was in the Birth to 3 program through the state of Wisconsin, mm-hmm. and our provider was Easter Seals. Okay. And the people that I met through Easter Seals were phenomenal. I had amazing therapists. Our PT especially was phenomenally dynamic, and she was, I point her out because she was with us from the time he was 3 months old to the day he turned 3. Okay. So she was with us the longest. And she was always encouraging. She was always supportive. She really listened to my needs and then would help try to find resources for them if possible. And we were told for so long, like, Matthew was never going to walk. And I just remember the day that she turned to me and she said, I'm going to get him to walk. He's going to walk before he turns 3. And he walked at 2 years old. Mm-hmm. So she was just a huge, empowering, supportive individual. And I met many of them through that organization as well. And a lot of them are still friends now.
Okay. Okay. So the people through Easter Seals, which is a phenomenal program, you know, as well.
Right.
First, the 3 program itself, because that's where I feel like I met the most people, was in that beginning stage, that birth to 3. And it wasn't all the doctors, you know, it was like random therapist, the random counselor that might have not even been your counselor, that can kind of in distress. And sometimes they just have those perfect words. I remember that one of Marcus's, his PT, her name was Carol. She said to me, because I had, you know, Marcus and obviously 2 other children already, so there's 3 of them. She said, Tammy, I want you to understand that every child has needs. And you're going to know that when you have teenagers. Every child has a special need. And now that I have 4, I can tell you that every child has some need. And so it lightened it up in my head, instead of this list of what your child has, just like, know that no matter, you know, your child, every child is unique, and they're all going to have their struggles and their strengths. And so to just keep that in your mind at all times. And I just remembered that. So that's awesome to hear that you had that same experience at a different facility, you know, like that with, you know, the therapists and whatnot. So you've gone through this transition now. You're kind of getting a grip on the things that, you know, medically are going on. You're rolling with the storm.
Right.
And now we're here, or possibly 6 to 7, 8 years old. Mm-hmm. Where have things come medically for him full circle? What are his diagnoses? And kind of what do you know health-wise do you have to be very cautious of advocating for the future?
Well, luckily, knock on wood, he is a pretty healthy kid. So we have been able to keep his epilepsy in check through medication.
Okay.
And he only has maybe 1 to 2 seizures a year.
Okay.
So that's very manageable. He obviously, having cerebral palsy, he does struggle. He struggles a lot with his writing, but we work with him on typing and learning how to use email. And now that we're really in an electronic age, we try to utilize those opportunities more so he can have things that are more accessible to him. Because if he had to write everything out, he would be writing all day long.
Right.
And very tired. Really, the only thing that is a concern, since he is in a mainstream classroom, is germs. Gee, like you can't get away from that at all. So it's very, I don't want to be the mom who wants to put her child in a bubble. But anytime Matthew gets a fever, it's a concern. And if the fever gets to be 102, doesn't matter if we think he's got the flu or not, we have to go and make sure nothing is getting into the shunt. Because if any type of infection would get into his shunt, it goes straight to his brain and could theoretically, he could lose his life. So that's a huge concern. So we live with lots of disinfecting wipes. We live with antiseptic hand cleaner. We're always about killing the germs and staying healthy.
Okay. Now, so at this point, he's 8 years old. And what are his list of diagnoses? So he has obviously hydrocephalus, he has cerebral palsy, he also has epilepsy, and then is he cognitively and like globally delayed as well? Does he have, you know, how significantly delayed is he behind in like schooling in our cognitive functioning? If he's 8 right now.
He's about a year behind cognitively.
Okay.
But, I mean, he's still in a mainstream classroom for his age, and it does pull out for special ed. And he's starting to, I mean, up till this year, he was right on pace. Now he's starting to fall behind. So that gap is getting a little bit wider.
Okay.
And he also had, one of the things that makes learning for him more difficult is he does have ADHD, attention deficit hyperactivity disorder. That runs in our family. So my ex-husband, myself, and my daughter all have it. So he should too. He doesn't get away with it. And he also has NVLD, which is nonverbal learning disorder. And when I say that, a lot of people think, oh, he doesn't talk. No, he talks a mile a minute. But he does not understand social cueing, and he doesn't understand sarcasm, and a lot of times he doesn't understand jokes. So if people are laughing because the joke is funny, he'll laugh, but he doesn't know why he's laughing.
Okay. Okay.
So there are a lot of times when he's being given direction in school, he may hear the direction and he might even be able to repeat it word for word, but it doesn't mean he's comprehending it.
Okay. And so in school, that's good. So he's about maybe a year behind, or almost just a little bit there. And then with those things, so moving forward, have the doctor said anything with his diagnosis is like as he ages? Are there, aside from the fevers, the concern for the shunt,
Right.
I don't know, does shunt revisions, do those have to happen like every 5 years, 10 years? I mean, I'm not sure how that protocol is.
Well, and it's different for every child. So some kids will have shunt revisions. They'll take out the shunt and replace it. That's called a revision.
Mm-hmm.
And some kids will have multiple shunt revisions in a year.
Okay.
Some may be able to go all the way to adulthood before they have one. Theoretically, you should never have to have one, but almost everybody has multiple.
Okay.
And the placement of the shunt for a child or adult with hydrocephalus, that is the only thing that keeps them alive. If they did not have that shunt in there, the cerebral spinal fluid would take over and they would die.
Okay. So this is obviously going to be a lifelong
thing.
Lifelong. And with the cerebral palsy, did they say that as he ages, there's anything that you should be watching for changes, or is that kind of like the insult happened and it's there and it's just kind of stabilized and he just continues to work on that one side?
So far, it is stabilized. As he ages, it could become more progressive depending on what happens with pressure in the brain. Right now, no one's saying that we need to worry about it progressing at all. But I can say that as he has aged, some of his abilities have changed. Okay. So about a year ago, we did decide that it was time to get a wheelchair.
Okay.
And it's just because he gets tired very quickly. So I can't go to the zoo and have him walk around the whole zoo like an 8-year-old. About an hour and a half in, he needs a wheelchair.
Right.
And that's just kind of to be expected. But I don't allow that to limit us. It actually kind of gave us a lot more freedom once we had the wheelchair. Our excursions could be longer. We wound up being able to do more hiking, actually, on pathways that had access for wheelchair access. And he loves to go into the woods. And about a year and a half ago, before we had the wheelchair, we went into the woods and got stuck there for about a couple hours so he could regroup. So we have a lot more freedom now.
Okay. So, and that would lead me to my next phase of this is, you have been traveling this journey now for 8 years. Mm-hmm. If there is anyone that is listening today, and obviously you have a daughter too, so you're also, I'm sure, dealing with some of the effects of, having a sibling,
right,
with another child with needs, as I know myself as well. And so what would any advice that you would give, or how to stay in that positive zone? What are the things that you've done? I mean, I know that you have changed careers, you've done different things to put yourself in more of an environment that is the environment you need lifelong, because what your son has is a lifelong condition, where people understand a little bit more. So recommendations, things that have helped you, organizations that have possibly, helped you, or that you've gotten great content information, any of that.
Well, what really helped me along my journey was Parent to Parent of Wisconsin. It's a one-on-one parent matching program. And as we would come up against a new diagnosis or a change in how the diagnosis was needing to be managed, it was great to be able to call them and say, can you find a parent who's been through this particular part of my journey? Because I don't know how to handle whatever it is. In one case, it was, how do I deal with this whole pureed food thing with the school system, and how do I get my child to be able to eat with his classmates? Because the school was like, no, he needs to be separated. And I was like, no, he needs to be integrated. I'm very much an advocate for keeping children as much in a daily routine with their peers as much as possible.
Mm-hmm.
So I was able to get some real great advice that way, which helped me on my journey. And then eventually I became
you're a parent to
someone
parent
who like helps other families. So that
right,
was
right. You're part of
it
that
kind of went both
organization.
ways. Right.
Okay, that's phenomenal. So you got info from them, and then you became an advocate for other parents and to be able to help them as well.
Correct.
So parent to parent was extremely helpful. I know, like I briefly talked about in changing careers, where have you, as we kind of spoke of before, landed, and why is that such a great fit?
Well, my background was in children's educational broadcasting, and by the time I had Matthew, I was actually working as a college recruiter in the medical field. And that didn't really work for me, and eventually lost my job. And I was like, how am I going to ever get back into the work field? I was amazed that by being a stay-at-home mom with a child with special needs, I suddenly was told I had no skills. And as any parent with a child with special needs knows, they have many skills that are often overlooked. And that actually led me to Children's Hospital of Wisconsin. I used to joke that they should either give me a cot or a job. And eventually, apparently, they decided they needed to hire me. It was really transformative to be going from corporate America to, I mean, it's a corporate environment, but a very different environment that really engages people and understands the needs that our families go through, because that is who we serve as an entire entity. So to be able to have the flexibility that I need in order to be able to give the best care to my children is extremely important, and it's a value that they have, and I am very blessed to be there.
So as I always say, within the special needs journey of our lives is, planning and preparing for what's in your control and being honest with yourself and knowing that this is a lifelong, this is a lifelong struggle. This is going to be there. How am I going to proactively find a place, an environment that is going to be able to work with me? And so we are very lucky here. And obviously I had my my period of 3.5 years there as well, and volunteer work there too, and everything else, just because it is a phenomenal facility and organization to be a part of and to work for. Now, would you say that so we have parent to parent, we also have, and I'm sorry, I'm just checking my notes to make sure that I have everything here. Obviously that integration to children's. Any other advice that you might give on times of frustration with doctors, frustration of not getting, the answers that you're looking for, or how you keep just focused each and every day on the positive?
It's a great question.
It's a great question, but sometimes we have to think, because what I think happens is that we just do it.
Do it. You do.
Do it. I always preach that we don't, everyone loves the word, but we don't regurgitate negative information, because we're in that environment, and we could talk about doctors all day and doctor appointments and be at the hospital and live there. But the more we're talking about it that way, in that negative, it just makes it arise more.
Correct.
Within our lives. So some people do positive affirmation boards. They do those. I know my son, I have a positive affirmation board for him now every morning. We have to write down that we're happy for at least 3 things. So do you find anything that works for you? I always find it interesting when I talk to other moms and dads in the special needs world, that the different things that they do or do with their kids even.
Well, I do some journaling.
Okay.
I also make it a point, and this was something that I didn't really realize until I qualified for respite care. And respite is where a parent is actually able to step away from being a parent for a little bit and being able to fill their soul. So when I finally had the opportunity to get respite care, I joined a book club and like got to read a book, and to be able to read something that I could really enjoy, that was meaningful in my life, and then be able to discuss that with other people, that was huge. And now I take some of that respite time and I just do stuff with my daughter and focus some good time on her, so she doesn't feel that she is alone or that her brother gets all the attention, because that is a constant argument in our home.
Yes.
And try to really make that a special time, mom and her time.
I think those two things are fabulous, because, you know, the caregiver can't care for anyone if they're not caring for themselves. And though we can't get away for hundreds of hours, those little things that we can do for ourselves, that book reading, talking to an adult, even like right now, I look at this, it's like therapy.
Exactly.
Like, though I'm in my little area, you know, here, it just, you're able to talk to another adult. You're able to have that interaction, which is wonderful. And I think with your daughter, that is fabulous, because as we know, anyone that has other children and has other kids, you know, a child with special needs and then other children, it does become a huge, huge, huge struggle. It's a huge struggle to give that time. So that is fabulous. So anything else you'd like to add, Laurie? I know we've been chit-chatting. I don't even know how long it is right now. I don't know where we're at. 30 minutes, 40 minutes, an hour. But I'm just so grateful that you've taken the time to come on and share, you know, your journey. And I think that we will also revisit this again, because working at the hospital, what is your role there?
I am a family engagement coordinator. So I actually work with a lot of the families that spend a lot of time at Children's, and I do some training with them so they can sit on executive level committees throughout the hospital system, right with our providers and our staff, and help us make the best changes for the people that we serve. So whether it's for our patients or whether it's for the families that come through our doors, how do we improve our services? How do we provide the best care for those that need us while we're there?
That is awesome. So like I was saying, you might be on again. Breakout session, maybe about siblings or about supports and services. But I'm so happy that you took the time tonight to share your story with us. And then I am going to add all of those website links that you gave me, the places that you thought would be positive for folks to check out if they're in your same situation as well, or maybe some of the underlying things are similar, just some things that they should look at for point of reference and possible support.
Right.
So,
that'd be super.
All right. Well, with that, that concludes the 5th episode of the On-Air Advocate. I am so thankful and grateful that you've all stuck with us this evening and listened in. And we will be back next week with a new episode. So please go to www.onairadvocate.com, where you can check out all of our social media links and all of the information we'll be doing all week long about hydrocephalus. And thanks again, and God bless. And thank you, Laurie, for joining us.
Thanks, Tammy.
Bye-bye.
Bye-bye.